Mrs. Hopkins,
Here.
Mrs. Burdick,
Here.
Mr. Barnes,
Present.
Mr. Decker,
Here.
Mr. Havey,
Here.
Mrs. Root, Mr. Stockin,
Here.
Mr. Crandall. 7 members present.
Thank you, and we do apologize for starting late. It has been a very busy day here at Committee Day for the legislature, so we will move things right along. We're actually going to be changing a couple of things in our agenda, but the next order of business is approval of minutes for the July 7th, 2021. Motion by Mr. Stockman, second by Mr. Decker. Any questions about that or changes? If not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Okay, and now we're going to have a change of order on the reports from departments. Dr. Robert Anderson will be going first, our Community Services Director, with a request for a budget adjustment. Thank you for coming, Dr. Anderson. Just be sure you got your button. Yep,
Thank you. Did I get the right button?
you did.
Thank you for letting me go first. The rest of you, I guess they all left. Their protest. I do have just the one budget request. It's from results from OASAS giving the Allegheny Council $7,000 for their community residents. They needed to remodel and revamp a bathroom, and so the state gave them the money to do that, and we need to be able to pass that on to them.
Okay, so we need a motion on that. Mrs. Burdick, second by Mr. Havey. Questions about that? If not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed.
Thank you very
All
much.
set, Dr. Anderson. Thank you very much for coming today. Okay, and now we'll go back to our report from the Health Department. Our Deputy Public Health Director, Jamie Darcy, is with us today. I should mention that the Director, Tyler Shaw, is serving his country as part of the reserves right now. So we appreciate your being here. Thank you, Jamie. Mhm. Okay, there you go.
Thank you. As Judy said, Tyler is away, so he has asked me to give you guys an update on what's going on in the health department, particularly with COVID. As far as vaccines go, we've had administered 6,459 first doses, 5,981 second doses for a total of 12,440. 21 of those were given last week at the Allegheny County Fair. We're looking to go to the Garlic Festival on September 18th and 19th. Hopefully we can get Johnson & Johnson. It's a little bit on back order. So if we can get that in time, then we definitely want to go there those few days and try to get more of the community vaccinated.
Great.
As of today, we have 11 active positive cases and 29 isolated in quarantine. And no Delta variants have been sequenced by the state lab at Wadsworth.
Say that again, Jeremy. So that they're not the variant strain.
So out of these 11 active cases, not one of them have been identified or sequenced, we call them, as the Delta strain.
Okay, thank you for clarifying that.
I would have to go back and look at those. We have 4 main variants, and Delta is the 4th one, but I would have to go back and look at all of the numbers since the beginning, but these 11 that are active are not Delta variants.
If it was discovered here in Allegheny County, what would be the protocol to handle that?
Nothing would change.
Mr. Race, we're not hearing your questions.
Oh, I'm sorry. Forgot to turn the mic on.
I did too.
I'm just curious about the variant, if it's shown a footprint here in Allegheny County, and if it does, what the protocol is going to be to handle that.
So nothing has changed at this time with our protocol or our process. We would still trace the same. We would still quarantine and isolate the same. Obviously, it would be brought to the Board of Health attention, And Wadsworth is the one that lets us know. We just know if we have a positive case, and until it goes to them and is sequenced, we don't even know if it's a variant, and sometimes that can take weeks to get that result back anyways.
When and if it gets discovered, now, it's my understanding that this thing is highly contagious, more so than the COVID-19 itself. Would there be a public announcement, or?
I'm sure that
The House
Tyler would want to
Bill
do a public announcement that any press releases have to go through Carissa, and I'm sure we'd get that out as quickly as possible. Again, we continue to try to vaccinate. Again, it's been slow, but we continue to get a few here and there, so everyone makes a difference.
God bless you folks, you've done a terrific job.
We actually interjected questions into what you were trying to say. We have 2 more questions. Can we take those 2 questions and then have you go back to your report?
Yes.
Okay, Mr. Healy was first.
Thank you, Madam Chairperson. Any plans to offer booster shots?
Not at this time. We did receive some notification from a call with the state the other day that Moderna is looking at doing 12 to 18-year-olds very soon. Pfizer is also trying to get approval to do 5 to 11-year-olds, and that will probably be looking like it may come to fruition in late January. And then Pfizer is also looking at full license through the FDA, not emergency approval, in 2022. But at this time, as far as boosters go, it's being talked about, but none of them have came forth and said whether they're going to be offering them at this time.
Thank you. Okay, Mr. Barnes had a question?
Yes. Is Allegheny County still the lowest percentage vaccinated in the state?
Yes, we are. We're right around that 40% mark, and a new report came out from CDC on Monday that even though we are the lowest vaccinated county in New York State, we also actually have one of the lowest rates of infection at this time.
Correct.
So what do you attribute to the fact that Allegheny County is the lowest in the state? I mean, is there any, from the health department standpoint, is it some reason that our population is too conservative or whatever, that they're not stepping forward and getting the vaccination?
Personally, what I've heard at clinics from friends, from families, is mostly their political beliefs. We continue to try and push on, and with the back and forth that you see from the CDC and from the government, that's not helping make people content and feel like that they're safe and better off getting it. So those are the concerns we hear on a daily basis from the public.
Okay, my last question then is, New York City's changing the rules and requiring only vaccinated people can attend, they could eat or eat inside in restaurants and Broadway shows and theaters and so forth. You have to show proof that you're vaccinated. Is any talk of that spreading statewide?
Tyler and I had a conversation early this morning on the phone, and the last either of us heard was it's still up to the local governments on what they want to put in place. So I don't see anything coming from the governor's office or from the state level DOH at this time.
Thank you.
Thank you.
Mr. Fenton has a question.
Are any of the 11 that you talked about have they had the vaccination? Or are they unvaccinated?
I did not look at that. I know we've had a few cases, breakthrough cases is what we call them. I could go back and look at that information and send it off to Carissa if you would like.
No, that's okay. I wondered but there have been people that in Allegheny County that have received the shot, but yet they got a mild case of this corona?
Yes.
Yeah,
Yeah.
so.
Yeah,
So
so
it
we've
does
had
happen.
some breakthrough cases, but I don't know the number, and I don't know if they're
Yeah,
part
I
of
don't
this
need
11.
that. I just wondered if it had gotten to that point here.
Okay, thank you. Thank you. Those questions were all pertinent to what you were talking about in your report, but we'll let you go ahead with your report.
Okay. We also have 2 first dose clinics scheduled for August 6th and 11th, and a total of 5 second dose clinics still scheduled for August and all the way out till September.
Those will be rotating around the county like they have
Those,
been, and they'll be published in a press release.
Tonight is the last second dose clinic that is out in Whitesville in the public. All of the other ones are here at the Department of Health. We tended not to see a lot of participation in the public, so I think we are going to be looking at mostly staying here and offering it here either on a weekly or bi-weekly basis.
Thank you. I'm sure that'll be in a press release.
Yes.
Yeah, thank you.
As far as the Allegheny County Fair goes, we had a great time at the fair. We offered the COVID vaccine on 2 days. Unfortunately, on the first day, we only had 1 person, but we also got 20 people to get the vaccine on that Friday, which was great, more than we anticipated. We also would like to thank the Allegheny County Fair for donating the WIC booth to us. And the environmental staff did a tremendous job in getting the inspections done. The fairgrounds were inspected, the campgrounds, and 20 food service sites in a total of 2 days. And usually it takes us most of the week. So they did a wonderful job in getting that done. The only other thing I had on my list for open discussion is lead. Lead cases continue to be on the rise. Part of that, I think, is mainly people were being stuck in the homes. We weren't allowed to go out to the homes to investigate these cases until July 1st of 2020. We are seeing environmental making a difference and trying to get some of those cases closed up. We went from 49 to 42, so we've closed 7 cases. And nursing, it also has 44 active cases. Nursing is continuing to work with nurses, doctors, the community, and we'd like to thank DSS, Early Childhood Development Coalition, and WIC for helping us get lead information out to the community and to the public by putting flyers, putting fact sheets in their bags and handing them out at their clinics.
Great, good, thank you.
That's all I have for open discussion.
Okay, first let's see if there are any other questions about the report from the legislators. Okay, go ahead, Jamie.
The second item on my list is a request to transfer funds. This request is a transfer of $3,391 from health contracts to health equipment and general supplies. These monies were originally budgeted for billboard advertising, which we have not used. And we would like to reprovision that to be utilized for purchase of equipment for COVID and emergency response activities.
Okay, thank you. We'll need a motion. Mr. Havey, second, Mr. Stockin. Okay, any discussion about that motion? All those in favor, please say aye. And any opposed? Okay, that motion is passed. Thank you, Mr. Barnes. Okay, anything else you'd like to mention, Jamie?
No, ma'am.
Okay, we appreciate your coming and thanks for all your good work.
Thank you, Judy.
Okay. Next on our agenda is a report from the Office of the Aging Director, Anita Madison. Thank you for coming, Anita. We appreciate it. Okay, we'll get hooked up there. Okay,
Hi,
hi,
how are you?
good, good. Thank you for coming.
Thank you. So the first thing on our agenda is our monthly report. There are a couple of things I'd like to highlight. For June, if you look at our Meals on Wheels, our numbers are starting to increase again for Meals on Wheels. This time last year, we were serving over 11,000 Meals on Wheels. In Allegheny County, last month, we were down to over 8,000 and we are up to over 9,000 for June. So we're starting to see an increase in Meals on Wheels once again. The other thing that I would like to highlight is our caregiver services. This time last year, we were at 137 units of caregiver services, and in June of this year, we're at 309. So we are continuing to see an increase in caregiver services and Alzheimer caregiver disease, Alzheimer's disease caregiver support initiative program, which is all inclusive in that caregivers and ADCSI line.
Do you see any reasons for that increase in that particular area?
We have a lot of caregivers who are starting to go back to work or are finding it more difficult to balance a lot of the new demands that are on them, and so they're reaching out to us for caregiver consultations as well as respite.
That makes sense. Thank you. Okay. Okay, any questions about Anita's report? Okay, and we have some approvals to go through.
So the next thing on our agenda is our office is asking permission to enter into an agreement with Cafe Jacobs in Bolivar, New York for the restaurant Go and Dine program. We had come to committee previously and spoke about the Go and Dine program, and what we were doing is getting contracts in place in order to implement that program. This is the first of those contracts. The program will provide services in Allegheny County to residents 60 or over who want to participate in the Go and Dine program. It's a supplementary program to our traditional congregate luncheon center program.
I think it's a great idea. Anita and I discussed it the other day, and as the numbers have gone down somewhat in the congregate luncheon program, this is a way to connect with that population, the over 60 population, and provide them with nutritious meals at a reasonable cost and the opportunity to get out and be with friends. So I think it's a wonderful program.
Thank you.
So we'll need a motion to start this. Mr. Stockin, second. Mrs. Burdick? Okay, any questions about this? Okay, yes, Mr. Spanton.
Yeah, I typically went to one meeting at the centers a year now, where, you know, to get acquainted type thing, or are we gonna, how would you do that with this dining?
Again, this is to supplement, so this isn't to necessarily replace. So
Okay,
we
so
will,
they will still be open then?
Correct,
Okay,
yes.
thank you.
This could very well be a different audience than the people who go to the congregate luncheon center. I think that will continue to serve a very worthy purpose, as will this with a different over 60 population. So, okay, any other questions? Okay, all those in favor, please say aye. Any opposed? That motion is passed. Thank you. Next, we have an addendum to the Good Times of Olean agreement.
yes, so we are interested in or looking for permission to enter into the agreement to increase the rate per meal for the time frame of August 1st to December 31st. The rate per meal currently is $4.75. We are looking to do an adjustment to the contract for $5.40 per meal. The reason for this cost increase or request for this cost increase is because of the supply cost as well as for recruitment and retention of labor for the positions to maintain the Meals on Wheels and nutrition program through the caterer.
Okay, thank you. We'll need a motion on this. Mrs. Burdick to start, second, Mr. Stockin. Okay, discussion on this. Yes, Mr. Barnes.
So when was the original contract for $4.75 per meal signed?
That started January 1st. It was the first of our 2 one-year extensions that were in our original contract from 2016.
So, and was the $4.75 an increase from 2020?
No, the $4.75 was in the original contract at that 1 year.
So
We-
they've been
we did not
operating
increase it.
on, and so is this due to inflationary costs of food, et cetera?
Yes, it is. So he did do a breakdown, which I was able to provide to Carissa, Terry, as well as Tim, in regards to the cost to make sure that we understood where the cost request was coming from. The cost of beef is about 70% more from this time last year. So when we entered into the contract in January, it was feasible at $4.75. At this point, it's not feasible to sustain at $4.75 per meal. In addition, he has lost staff to go to Walmart to to stock shelves for $19 an hour. So it's an increase in labor costs for retention of employees as well.
Thank you.
Welcome.
Okay, I think we're ready. Oh, Mr. Decker.
Anita, in the paper, it was stated that Good Times is going to try to reopen in the fall, and also a possibility that he's going to put the business up for sale. Do we have any options going forward that we can be prepared with?
We are currently working on a few different options. We are looking at the jail as an option. There are a couple other options that we are looking at. So we have started those conversations already in preparation for the possibility of that. Good Times has been for sale for a while now, actually. I think I came this time last year and I explained that. His reopening plan has nothing to do with the price increase. I did clarify that as well as soon as I saw that there was a reopening plan. And the books for the reopening plan and the books for our contract are separate, and we can audit them separately.
I wasn't thinking about the fact that it was going to influence the price of our meals. I was thinking more that it was going to take time away from him being able to serve his meals in the restaurant and still provide the Meals on Wheels.
He has a separate team for the entertainment portion, as a separate team for the contract. So the nutrition services contract and the nutrition program has a team that is separate from any entertainment or reopening plan.
Mr. Harris.
I guess a question for Carissa. Is it common for a vendor like this to adjust rates in the middle of a contract?
I think we saw that with the previous vendor for this same contract. So it happens, you know, we started this contract back in 2017. Prices of food have fluctuated throughout this. That does affect what he can provide for the same amount, so.
Having not seen this contract, does the contract stipulate what is included in the meal? What, you know, so
very
much protein, so
specific.
much protein, so much whatever, carbs, whatever?
Extremely specific because there's a nutritionist that has to work on each meal and it has to meet those requirements.
Does this rate increase seem appropriate to you?
I think so. And we did increase it even more for a brief period in time last summer when the prices went up so high during the middle of COVID. And they did come back down, but I think we're looking at trying to plan for next year, and this is an appropriate price for this. And I know Anita is working very hard at looking at some alternatives as well.
Okay, so last question.
Sure.
If you're in a market with fluctuating costs like this, like Good Times is, are they able to sign a contract with a range of potential costs to the county?
I think we're in a much better bargaining position to lock them in for a price and have them come back to us if they want it adjusted and justify why they want that price to go up or down. They're never going to come back for it to go down, so I'd rather lock it in and see them come back.
But it's not locked in because we're changing,
Well,
we're changing it.
We don't, this is for next year. So
No,
they'll
it's
be
for the remainder of this year, right?
right. They'll be locked in for that. We could say no and hold them to the price for this year and risk them failing and asking to terminate. There's a provision in there for them to terminate as well, but I don't think we want to do that. And we could go back and counter, but as Anita said, she's done all the homework to go over the prices for the meals. And she feels it's appropriate.
And this increase is from August 1st through December 31st of this year. So we would certainly be anticipating another contract for 2022. Is that correct? Or
We do have the option for one additional one-year contract extension. When we were talking regarding the rate, that would have to be a sustainable rate for the program for the remainder of this year, the 6 months that I have. I also asked for what it would be if we decided to extend for the last 1 year extension, with the understanding that we would not go out for another price increase. So this rate is something that would get us through this year. It also is understood that if we go out for the next 1 year extension with him, that there would not be a different rate than this rate right here. And this is actually what we budgeted for in our 2022 with that anticipation.
Okay, thank you.
Thank you.
He's been pretty stable with his rates other than the COVID, correct?
Correct.
Okay, any other questions, Mr. Fenton?
Yeah, well, I think everybody's taking advantage of the COVID. It's typical of cost of living. It's been going up about 6%, and the increase he's showing is somewhere around 12%. So, he's, in my mind, he's taking advantage of the COVID situation too. He's getting a little more than cost of living there, so.
So this does accommodate for supply as well as the labor. So that's all inclusive. I did send that information as supporting documentation.
Most businesses, if they have a labor increase, they do increase their prices, but that's not necessarily when they have a contract.
That's true.
Okay, I think we're ready for a vote. All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you, Anita.
Thank you.
Okay, and we have one more for the Regional Alzheimer Disease Caregiver.
Yes. So we are interested in requesting permission to apply for the Regional Alzheimer's Disease Caregiver Support Initiative, or what we refer to as ADCSI. This grant is a continuation of our ADCSI grant from 2016. It is actually in partner with the Alzheimer's Association of Western New York, as well as Erie County, Niagara, Chautauqua, Cattaraugus, Wyoming, Genesee County Office for the Agings. We have already budgeted for this as $124,000 for the 2022. We've had this contract or this grant for the last 6 years, so this is to apply for the extension in the next term.
And the grant is continuing. I mean, it is going to exist, so our chances of getting it are pretty good.
Correct,
Yeah.
as long as we are partnering.
Yeah, okay. We'll need a motion on that. Mr. Havey, and second, Mrs. Burdick. Okay, any discussion or questions on that? If not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed.
Thank you.
Thank you. Anything else you'd like to add, Anita?
I do have a couple additional things.
Okay,
In your packet, you will see for the 2021 Senior Farmers Market coupon booklets. They are still available. They're available till the end of September for anyone who is 60 or over and meets the income requirements. United Way of Allegheny County has provided additional funds for us to supplement an additional $10 voucher that is good at any of the Allegheny County participating farmers markets. So our older adults can receive a total of $30 in fresh produce.
okay. Thank you.
The next thing that I would like to mention is we do have an Allegheny County fraud prevention event coming up Tuesday, August 17th from 10 to 2 at the Genesee Valley School. This is actually being hosted by Senator Borrello's office in collaboration with Allegheny County Sheriff, Allegheny County Office for the Aging, Center for Elder Law and Justice, and the Attorney General's office. We will have representation from all of those agencies at the event. In a brief one-on-one meeting with the Center for Elder Law and Justice will be available for older adults to have their credit report pulled if they think they've been a victim of a scam. And Center for Elder Law and Justice will be able to go through that with them, identify any red flags, and talk to them about how to correct those issues or protect themselves.
Okay.
Registration does go through our office, and we wanted to make sure everyone was aware of that event.
And why don't you just give the date again and the location?
Sure.
For the public.
It is Tuesday, August 17th, from 10 a.m. to 2 p.m. at the Genesee Valley School. Registration deadline is Tuesday, August 10th, to our office.
Okay, good. Thank you. Okay,
And the last thing that I would like to announce is just prior to our meeting, I was informed that there was an error printed in the Cuba Patriot on page 15, announcing that on August 11th, we will have a senior picnic at the fairgrounds.
We are working on a press release to get that information out. We do not have a senior picnic this year. I'm not sure where that information came from. I've already contacted the Cuba Patriot. They are closed for 2 weeks for vacation. So we are working on correcting that issue. And I just want everybody to know there is no senior picnic on August 11th, so please do not go to the fairgrounds.
And please share that with your neighbors,
Yes,
those who are listening.
correct.
Yes, Mr. Barnes.
Talking about the senior picnic, are you planning on resuming it next year?
We hope so.
So,
Our plan is to, but my plan was also to have one this year. So, if everything holds.
and the county fair came off, but you just didn't have enough time to do it, is that primary?
Correct. So it is a large event. When I would have had to begin planning, we were not in the state where we are now, where I could safely put 700 older adults underneath a tent. The difference between the fairgrounds is it's a much larger area, where our senior picnic, everyone is sitting underneath one large tent, elbow to elbow. I would have had to start a waiting list at about 400 to participate, which would have left about 350 seniors on a waiting list for a senior picnic. If I chose to go that route, but I could not safely make that call when I needed to, because we weren't where we are now.
Thank you.
You're welcome.
Thank you. I think one thing we've learned out of the last year and a half or so of COVID changes and disruptions is that everything has to be capable of change. And we can plan and hope and hope. So,
Absolutely.
yeah. Thank you, Anita. Appreciate it.
Thank you.
Okay, next on our agenda is to hear from our Social Services Commissioner, Edna Case. Edna, thank you very much for coming today. We'll let you get hooked up there. You need something passed out?
Yes.
Okay. Mr. Harris will be happy to help you. He's very good at that. Thank you, sir.
One for every human services member, and if anybody else wants to share that.
Is that something I already have, Ms. Case? Okay.
And if you could give one minute and
Okay.
Megan, your name tags are,
Megan.
Megan, Brenda today.
She says I have one. Yes. Thank you. Okay. Okay. Annette, go ahead.
Monthly report seems to be status quo, although I'm sure do want to share something with you. I think Legislator Haley would be interested in this. The Child Advocacy Center, the Office of Children and Family Services completed a review of the Child Advocacy Center. Interviewed multidisciplinary members throughout the review, and we are doing very well. No corrective action plan will be taken. They complimented us on how well we've done getting going in short notice. So I thought that was really good. I thought I'd share that.
Appreciate that. Edna, we need to have your microphone turned on. Just push the button. Sorry, it happens to all of us.
So you missed the good news. We are up and running in Job Track. I think I shared that with you last month. We currently have, and I can't tell you the number of individuals, but they are receiving their physicals so that we can give them some placements for some job experience. So that's really my highlights for that report, because I figured that we were a little heavy today.
Okay. Any questions about her report? Okay, let's proceed then.
So we have a request to reappropriate CARES Act Emergency Solutions Grant Funds. That is, we accepted that last year, but due to state constraints, we could not claim that money. we can now claim that money, so we would ask to have that accepted. COVID also had a role in that because people were not getting evicted, so it was kind of hard to use that money. So we are hopeful that you will approve those appropriations and
Okay,
And that
so
movement.
that amount is a total of $196,279 that
that
we're
is
dealing
correct.
with?
yes.
And I would take a motion for that, please. Mr. Havy, second, Mr. Stocken. Okay, is there some discussion about this? Okay, if not, all those in favor, please say aye. Aye. Any opposed? That motion is passed. Thank you. Okay, next.
And then we
Uh-huh.
are asking to request a resolution to accept and appropriate the additional federal aid for the Department of Social Service CARE Act. Again, ESG funding allocation. These budget adjustment changes are requested based on the recent received allocation award letters. So these are the new allocations in the amount of $227,582, $30,000 of which is Code Blue money.
Okay. Thank you. We'll need a motion on that, please. Mr. Stocken, second by Mrs. Burdick.
Code Blue.
Okay, any questions about that? If not, all those in favor, please say aye. Aye. Any opposed? That motion is passed. Thank you. The next order is the budget transfer.
Yep, we want to request a budget transfer to cover the attorney salaries, and I want to thank Terry for working on this with Don. Thank you very much. This transfer is necessary as our attorneys change from being contracted attorneys to hiring them as employees. At this point in time, we are only, we will be moving the senior social services attorney from a contracted attorney to part-time on August 30th.
Okay. So, but the motion would be on all three positions, the first
Yes.
assistant as well as the second assistant.
Yes.
Okay. Okay, we'll take a motion on that. Mr. Stocken, second, Mr. Havy. Okay, are there any questions about this? As we know, this was part of the change in positions, and hopefully this will work out very well for DSS and for the county. So, any questions about it? If not, all those in favor, please say aye. Aye. Any opposed? That motion is passed. Thank you. Okay, and the next order is the Accord contract for
Yep.
HEAP.
We are requesting a resolution to approve the contract with the Accord Corporation to provide outreach and certification services for HEAP for the 21-22 season, which early outreach starts on August 30th. The fiscal impact is $15 per application with a $500 minimum,
Okay,
maximum, sorry.
okay. Thank you.
Sorry, I'll wait.
We'll take a motion. Do we have a motion on this? Mrs. Burdick, second, Mr. Havy. Thank you. A question for Mr. Harris.
Just out of curiosity, why do we farm this out?
We're required to farm it out to at least one entity to help us with HEAP applications as part of our regulations.
But you take your own as well in-house?
Yes.
Any idea how that splits out? Do you do a lot more than they do?
Yes. They really don't do very many, but we also do contract with OFA, which I have that contract here today. That's what I handed out at the last minute. I apologize for that.
Thank you.
Okay. Other questions? Yes, Mr. Healy.
Yes, Commissioner, with most of the people that get those services through your office, they're probably getting other services through your office also.
Yes, but there are people that only receive HEAP.
Okay.
I can't give you the number, but there are.
And that's probably true too up with the OFA.
Yes.
Thank you.
Okay. Okay, I think we're ready for a vote. All those in favor, please say aye. Aye. Any opposed? Okay, that motion is passed. Thank you. And now an approval for Catholic Charities, Kinship Family and Youth Services contract.
This is a contract, I believe, it is for $47,150. It's an addition, it's a $49.88 per day per child is needed. 62% of that is state reimbursement, 38% of that is local share. This is for a preventive, for a prevention program. It's a PINS respite bed that we are required to have. And so we contract that bed with Kinship. It's a PINS respite bed. I believe that in this year we have used it twice, but we are required to have the contract.
Okay, I think we have a number of other contracts like that that we have to have in place, but we don't pay unless we use them. So we'll take a motion on that, please. Mr. Stockin, second by Mrs. Burdick. And any discussion?
And is the 38%, is it the local share, is that budgeted or is,
38, yes,
so you're good with the budget?
yes.
Thank you.
Okay, thank you, Mr. Graves. Any other questions? Okay, if not, we'll take a vote on that. All those in favor, please say aye. Aye. Opposed? Okay, that motion is passed. We have one more. This is the one that Commissioner has just passed out. It's a similar contract with OFA regarding the heap services.
Yeah, so this is a contract with OFA to provide outreach and certification services for HEAP for the 21-22 season. The fiscal impact is $38,500.
Okay, and is that already budgeted?
Yes.
Okay. Need a motion on that, please? Mr. Stockin, second by Mr. Decker. Okay, any discussion, questions? This has been a longstanding contract as well.
Yes.
Over the years. Okay. All those in favor, please say aye. Any opposed? Okay, that motion is passed. Anything else you would like to share with us today, Edna?
No, thank you.
Okay, well, thank you for being here today and discussing all these things. Mr. Fenton?
I have a question. If I could, I'd like to go back to that CARES Act Emergency Solutions Grant that basically, as I understand it, it says reapportionment necessary to spend grant funds to benefit person displacement due to lack of personnel funds, to pay rent, utilities, and to prevent homelessness. Is that money given to the actual renter, or is it given to the landlord as it's given out?
That money is given to the rentor.
So how do we know that the renter is paying the landlord? I know that's a situation that's come up.
Well, most generally, they do, but we haven't really used that money, so I can't tell you that it hasn't been paid. So even if we have a temporary assistance case where we pay partial rent, we do, with that, most often, that money does go to the rentor. If it's learned that the renter is not applying that money toward rent, then we can make that agreement for a direct payment with the landlord.
Okay, so your experience with this particular grant so far has been none, basically?
Yeah, it's been
So,
very,
I just to make it a point, there should be some follow-up. If these people are given money to pay their rent or whatever, then there should be a way for us to make sure that that's what they've done with it, because there's been a lot of that going on in other parts of the country, and landlords aren't getting their money.
I agree.
And so we just, if there is a way to do it, to follow up on that, it would be great if we could do it.
Well, I will take a look at that, see if there is.
Thank you.
Okay, thank you, good point. Okay. I think we're all set then with Edna, as she finishes her notes. That's fine, take your time.
Sorry.
That's okay. We'll go on to old business. Is there any old business? Any new business? Anything for the good of the order? Okay, is there a second? Mr. Stockin, all those in favor? We are adjourned. Thank you very much.